Gaining wisdom is something we all hope to achieve as we get older, but not necessarily when it comes to our chompers. Wisdom teeth can become a painful and bothersome part of our lives if not taken care of in a timely manner. So for more on this, we bring in Idaho State Dental Association Representative Dr. Justin Hastings, who's also with Whitewater Oral Surgery Group. Dr. Hastings, thanks for joining us this morning.
Absolutely. Happy to be here. Thanks for having me.
Of course. Yeah. First question for you. Something I don't know that a lot of people know. What exactly are wisdom teeth and why do we have them?
Yeah, so wisdom teeth, they're our third and final molar that develops typically in our late teens to early 20s. The reason we have them is because we used to use them back when our diet consisted of more raw plants, tough meats. We needed them to chew those types of foods. And now that our diet has changed and we eat more refined or processed foods, we have the lack of natural wear on those teeth and we don't necessarily have the jaw development that we had. So we have lack of space and we don't utilize them and they're more often impacted than not. So.
Gotcha. Wow. I learned something new right there. I had no idea. So why would you say dentists say they need to be removed, and do they always need to be removed?
They don't always need to be removed, but there's a few reasons, and they usually fall under a couple categories. There's symptomatic reasons and there's asymptomatic reasons. And the symptomatic reasons, they're pretty straightforward. Patients are in pain or discomfort because of those teeth, typically due to something called pericornitis, which is an acute infection under the tissue of an unerupted tooth. So removal of that tooth, elimination of that infection helps eliminate that problem. The asymptomatic reasons are the more common reasons that we're taking out teeth. And those reasons are positional, so impactions, meaning the tooth hasn't erupted properly in the mouth, it's not aligned properly in the mouth, and it's not going to come in and be functional. There's crowding reasons, they push on teeth, and they can cause periodontal problems, meaning deep pockets that can harbor bacteria and cause infections, also resorption of the second molars when they put pressure on those teeth. There's reasons, cavities, let's say. So our studies have shown that upwards of 40% of asymptomatic wisdom teeth have cavities, and there's a reason to remove them. And then also pathologies. So when a tooth develops, it develops within a developmental sac or a follicle. And when it erupts into the mouth, that developmental sac goes away. And if you have an unerupted or an impacted wisdom tooth, that follicle never goes away. And it's more prone to developing into cysts or tumors, which can cause problems down the road. And if you leave an impacted wisdom tooth in and our older age, we're more prone to mandible fractures due to the volume of that tooth that it takes up within the jawbone.
Okay, gotcha. And we are starting to run out of time, but let me ask you really quick, what should people know before they go in to get their wisdom teeth removed?
People should know that in our office, you'd come in for a consult. We'd go over the entire procedure. It's done under an IV sedation, so patients are asleep during the procedure and comfortable. The entire procedure takes about 15 to 20 minutes to remove the teeth. You're in our office for about an hour. Afterwards, we'd give you a long-acting local anesthetic called Exparel that keeps you numb in that area and eliminates the need for narcotics. And recovery on the other side is about a week. Doesn't mean they're down and out. It means that they lay low for the day of surgery and then ease back into normal routine stuff over the next week or so.
Okay, gotcha. Great information. Joining me this morning has been Dr. Justin Hastings with Whitewater Oral Surgery Group. Thanks so much for being here and the great information on wisdom teeth.
Of course, thank you.